Hello and welcome you all to this session of discussion of fertility, its issues and the respective treatments. So I am Dr. Leena Yadav and I welcome you again on board with me to discuss everything about fertility. Many times I have seen my patients come to me and they ask me, "Ma'am, should we go for an IUI or should we go for an IVF?" Many a times this also happens that I tell them that you have to go for IUI and you stand your good chances with IUI. And the patient shows reluctance to me that, "Ma'am, I don't want to go for IUI because the success rate of IUI is not very good, so I straight away want to go for IVF." One thing I would like to tell all of you, how to decide whether you are a couple who is eligible for an IUI, what we call as the intrauterine insemination, or you are a couple who is capable of going for an IVF, what we call as in vitro fertilization. So here I am talking to all of you as a fertility expert, as a reproductive medicine specialist, and I would like to tell you the different factors which let a fertility expert decide whether a couple should go for IUI or IVF. It's not that if you are young, you stand in the line of going for an intrauterine insemination to conceive a baby, or if you are an advanced age couple, you stand your best chance going ahead with an in vitro fertilization cycle, or what we call as IVF. Now there are many factors by which we decide which of the two treatments have to be undergone. So today I'll be speaking of the most important factor which helps us decide whether you are a couple who's eligible for IUI or IVF. For having a natural conception or for having a baby through an intrauterine insemination cycle, the most important thing is your tubes. The fallopian tube is the bridge between the ovary and the uterus, where the fertilization takes place and where the baby gets conceived and then travels to the uterus for implantation. If at all you have healthy tubes, then we can easily go for an IUI in your case, or we can also try a natural conception by giving you a little bit of fertility assistance, which can be through some oral medicines, through some injectable hormones, and that's it. But if your tubes are blocked, then no matter whether you're young, whether you have just 1 year of married life, or everything else is okay in you, the male partner, the semen is fine, but the most important thing is that if the tubes are blocked, the only treatment which that couple could undergo is in vitro fertilization. Yes, there are possibilities that there can be trials to open the tubes, what we call as hysteroscopic recanalization of the fallopian tubes. Now this goes into a lot of detail, and I will discuss with you in my next video that which patients are capable of going for a hysteroscopic recanalization of tubes and which patients have to directly go for IVF. The second important factor which helps us decide whether a couple is eligible for an IUI or an IVF is the AMH. Now what is AMH? AMH stands for anti-Mullerian hormone. AMH is a blood marker which helps a fertility expert to decide the fecundity or the reproductive age of a woman. There are certain values. If your AMH falls between 2 to 5 or 2 to 6, you are a person with a normal or a good ovarian reserve. Any AMH which is below 2 is in high alert for us to understand that this lady requires an assistance, and then Accordingly, based on the other hormones, we decide whether we can take you for IUI or IVF. So what I want to convey to you in this video is that it is not that easy that you just go to your doctor and you tell them that I want this kind of treatment. There are multiple parameters which have to be assessed, which have to be decided, and then the treatment goes forward. So I would recommend all of you to meet a fertility expert, discuss with us, and then let's take it forward from there. Thank you so much.